Hello and welcome back. Welcome to another Clinical Connections mentoring video. Today I'll be talking about an ever popular topic, one that has been gaining some steam in the past 3 to 5 years, and that topic is clinical versus non-clinical jobs for PTs and OTs. So you may have found yourself asking that question, should I go non-clinical? Is it time for me to go non-clinical? And you may have found yourself kind of scrolling through LinkedIn looking for potential non-clinical job opportunities. You might find yourself in some Facebook groups. You may have even thought, wait, is the grass actually greener on the non-clinical side of the street? So today I want to help you answer that question, or at least kind of give you some guidance on how to answer that question. I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I have worked in just about every setting that there is for PTs, and that includes both clinical and non-clinical roles. So I want to start with talking a little bit about burnout, because the root of everything that I do with my clients is to help them avoid and manage burnout. And I'm not denying that rehab professionals face a lot of burnout, but burnout comes from internal and external factors in the rehab world. Now, everyone agrees on the external factors of poor reimbursement, high productivity, high demand, low return on investment. Like nobody's arguing that. But a lot of people don't understand the internal factors of burnout and how they can contribute to rehab professionals burning out. So we can all agree that the daily grind of seeing 16 or more patients a day and always having to be on and the endless battle with documentation and only getting a 2% raise year after year, all that together is going to be a recipe for burnout. So these are all too common negative factors of the system that we work in, but they aren't special to our profession. They're not special to just clinical work. We aren't the only people that experience these stressors and negative factors when we go to work every day. But it can be really easy to imagine that a job, especially a non-clinical job, may not have these things. And it can be really easy to dream of a job where you wake up, you walk to the office in your house, you log onto your computer, you're working in your pajamas without having to worry about managing three patients at the same time. Sounds pretty sweet, right? But the non clinical world, especially PTs and OTs, can look greener. Okay, I'm not going to deny they can look greener. So, non clinical jobs are things like utilization review, case management, health informatics, medical sales, content creation, management positions can be considered non clinical. Clinical liaisons is another example. So these jobs allow us to take our clinical knowledge and apply them to other parts of the rehab world. So we can use our knowledge of medical status and functional abilities to approve therapy visits or decide whether or not to admit someone to a rehab facility. We can use our clinical knowledge to teach others how to use certain technology or sell certain pieces of equipment. We can use our medical and health knowledge to create content for companies or on social media or in creating CEU courses. And the perks to these non clinical jobs include working remotely, not having to work with patients for 8 hours straight, getting an actual lunch break, not having to document everything that you've done all day with every patient, or not having to deal with the bodily fluids, or patients constantly complaining of just something hurting, make it feel better, right? And I bet right now all of these sound pretty amazing. Right? I painted a pretty nice picture. And you're probably thinking that the grass is definitely greener on that non-clinical side of the street based on that picture that I just painted. But let's pause for a moment. Let's take a step back and actually look at the whole picture. So I agree, all those things do sound pretty awesome, especially for me. I'm an introvert, right? I do not like to be on for 8 hours straight. I need a lot of social rest breaks, right? But there's always more to the story. There's always more to the picture when you pull back and look at the whole thing. So while all of these non-clinical job perks can be true, they are true, there's more, right? Non-clinical jobs also come with corporate expectations. So meaning patient volume becomes or it gets replaced with meeting volume. And there's still productivity expectations that have to be met, especially with some more of those aggressive companies. Okay. It comes with sitting a whole heck of a lot more than you do as a clinician, with which comes with its own set of aches and pains and health implications, right? So I used to work clinically and I was running back and forth. I was working in a skilled nursing facility full time. I was running back and forth, getting patients, helping patients, doing manual transfers, a lot of manual work with gait training, stuff like that. And then I became a rehab manager, which made me sit more. I was still walking around the clinic and walking around the facility, so I did still got some movement. But then when I transitioned completely away from clinical and started to work from home, mentoring and mentoring students, mentoring new grads, I sit a whole heck of a lot more than I used to. I'm doing back to back to back tutoring and mentoring sessions on Zoom, 3 to 4 hours in a row, not getting up, right? So non-clinical can also mean you're sitting a lot more. The wins in non-clinical jobs are not as apparent as seeing your patient return to the field or seeing your patient walk again after a stroke, right? So there are some wins in non-clinical jobs, but they are not as easy to see as they are when working with patients. Pay cuts. A lot of non-clinical jobs actually pay less than clinical jobs. So a lot of people find that when they go from clinical to non-clinical, even with a doctorate degree, they're having to take a pretty significant pay cut just to go from clinical to non-clinical. And the last kind of negative is that non-clinical jobs can come with a lot of isolation, especially if that non-clinical job is remote. That is one of the main things that I have noticed. I don't have coworkers, right? It is just me working with my clients. So I don't get, I miss having coworkers to goof around with and to do things with after work. That's gone now, right? So a lot of non-clinical jobs, especially if it's a fully remote job, can be very isolating. All of this, all of these things that I just mentioned can lead to burnout also, because burnout just doesn't come from those external factors of poor reimbursement, poor pay, and high productivity. These factors aren't just found in clinical job settings. So these factors can also be found in non-clinical jobs too. And the other much more significant factors that lead to burnout are those internal factors like perfectionism and people pleasing and imposter syndrome. Those don't go away just because you've gone from a clinical job to a non-clinical job, right? These internal factors, they're inside of you, they're within you. So whether you work clinical or non-clinical, these factors are going to show up and they will still contribute to burnout. So, what should you do if you're considering a non clinical job? How do you know if the grass is actually going to be greener with that non clinical job? So, you can start by asking yourself, what is it about my clinical job that I don't like? Is it that you don't like working with patients, or is it that you don't like working with 3 patients at one time? Do you like solving that diagnosis puzzle? Like, what is actually happening with this patient? Why are they having foot drop, or why are they having this shoulder pain? Or would you rather solve other types of problems? Are you just trying to run away from something, or are you truly passionate about trying something new, something non-clinical in your career? Or is it you just don't like your boss and the demands of your current setting, right? So ask yourself those questions first. Then ask yourself, do I practice perfectionism or people pleasing, or do I struggle with imposter syndrome? If the answer to that question is yes, I have perfectionism. It's really important to me to please other people. I definitely notice that I have some imposter syndrome. If you answer yes to that, whether you work clinical or non-clinical, the job will not matter. You are still going to experience some burnout. So these things, perfectionism, people pleasing, imposter syndrome, they need to be addressed before you change anything about your job. After that, then ask yourself, what is it that I really want? What can I change about my job that might make me truly happy? So, your answers to these questions will help you figure out if going non clinical will mean that the grass is going to be greener for you. And I don't say all of this, I don't say, non clinical is not the way to go. I'm not trying to say that because for some people it definitely is, but it's not for everyone. And the grass on the non-clinical side of the road is not always going to be greener. And I just want you to make the best choice for you. Everyone is driven by different aspects of work. Everyone has different values. Some of those values can be found in clinical jobs. And some of those values can be found in non-clinical jobs. Everyone enjoys different parts of clinical work and non-clinical work. You just have to figure out what that is for you, okay? As PTs and OTs, we should definitely have a seat at the non-clinical table. Our degrees allow us to do that, and it's very beneficial. But going non-clinical is not always the answer to the challenges that you may be facing in your current clinical job. There are always options like changing settings, changing locations, or finding kind of a happy medium, maybe a mix of clinical and non-clinical work. But regardless, you deserve to be happy in your work and in your career. Okay. So ask yourself those questions, get the answers to those questions, and that will help you figure out if actually going non-clinical is greener, is the better move for me, or maybe I just need to change something in my current clinical career. Okay. I hope you have found this information to be helpful. I also understand that sometimes the answers to these questions that I posed are not that easy to answer, but I can help you with that. If you're interested in what that might look like for you, feel free to reach out to me. Leave a comment below, send me a message, however you want to get a hold of me, go ahead and do it. I would love to help you figure out the next best steps for your career. I hope you found this information helpful. I hope you learned something new today. Go ahead and drop your comments, drop your aha moments, something that really stood out for you. Drop them in the comments. Share something that you learned. Thank you for watching. If you have any questions about what I talked about today, feel free to message me. Leave your questions in the comments. I'll definitely come back and answer them, and I will see you next time.